So I want you to picture two babies born on the same day, same minute, same cry. One is born in Harare and the other one is born 12,000 kilometers away in Japan. Now I want you to watch these people grow. The one in Japan is probably going to live up to 84, 85 years old. In fact, their grandmother is going to live up to 90 because half of Japanese women are expected to live to 90 years old. And then the one that is born in our beloved country is only going to live to around 62, 63, 64 years old. This is a difference of 21 years. I mean, these are two babies born on the same day, on the same planet, and yet this one from Japan gets to live 21 years more than this one. This one gets to live an extra adulthood because 21 years is when you're considered an actual adult. You're allowed to do a lot of other things that you might not be allowed at 18 years old. Just imagine, this does not happen because of anything you yourself have done, but because of where you were born, of where your first cry happened. And for me, the most fascinating thing is that the one that is going to live up to like 63 years old is going to grow up in one of the most religious countries in the entire world. They will actually pray for long life, but they will not get it. Because in Zimbabwe, about 84% of our population is Christian, not to mention other religions. So I would guess that over 90% of Zimbabweans pray on a single day basis. In actual fact, 8 in 10 people in Zimbabwe claim that religion is something that they practice on a daily basis. So we live in a country where people pray for health, they pray for protection, they pray for security, they pray for jobs, and they pray for health because they want to live long. And yet, Japan is one of the least religious countries in the entire world. Only 7% of Japanese people claim a religion. So when you look at all this, the country that prays the most for long life dies at 63 years old, and the country that does not pray much lives up to 85 years old. So then the question becomes, why are Zimbabweans dying so young? And this is exactly what we're going to be talking about in today's YAP session. My name is Edlin, and as usual, welcome to my channel. If you're interested in the topics that I talk about on this particular channel, please do not hesitate to click the subscribe button and the bell so that you can be alerted every single time I upload a video. So let's just dive right into it. So before we do anything else, we need to look at the actual number, the life expectancy number. Life expectancy in Zimbabwe currently is around 62 to 63 years old on average. So life expectancy is an average number of years a person is expected to live from birth. This is calculated using the mortality rate in a particular population. So just for context, I'm going to put this graph on the screen to show you the global life expectancy from the 1900s up to today. And as you see this graph, you can see that life expectancy has been gradually growing. People did not live long back then. People are now living the longest that we've ever lived as a species. And the main reason why people are now living longer is because of modern medicine. People now get immunizations as children. We do have other factors such as better nutrition. We now understand which foods are good for people and which foods are not good for people. But at the core of this is just a better healthcare system. So it is important for us to understand that the only reason people are living longer nowadays is because of public health, the healthcare systems that people have been able to design. So the global life expectancy is at 73 years old and Zimbabwe is around 63 years old. So we live 10 years younger than the average person in the entire world. The reason why I'm mentioning this is because some people will say, oh, why would you mention Japan? Why would you compare us to Japan, which is the best case scenario? So this is exactly why I am comparing it to the global average. The average person in the world lives up to 73 years old, and we only live to around 63 years old. So we are significantly lower than the global average. So Zimbabwe is not just living 20 years younger than the best country when it comes to life expectancy. We are living a decade less than the global average. Can you imagine that Zimbabwe is ranked at around 178 out of 195 countries in the entire world? 178. Some leaderboards even say we are at 180th. Can you imagine? This literally means that we are living less than 178 countries in the entire world. But I want us to be fair right here. The story is not just about Zimbabwe being uniquely doomed and people dying young in Zimbabwe. This is the case in almost every Southern African country. In actual fact, almost every single country in Southern Africa lives below the global average. For example, we can look at Zambia, our neighbor, and they live up to 65 years old. The life expectancy in Zambia is 65 years old, so they're just slightly higher than us. So like I mentioned at the beginning of this video seeks to answer why Zimbabweans are dying so young. And for us to understand why we're dying so young, we need to just look at averages and we need to start looking at the death certificates. Unfortunately, the answer is diseases. And sadly, most of these diseases have been bitten in some of these countries decades ago, and yet we are still struggling with them. So I'm going to walk you through the 5 biggest killers in our country of Zimbabwe. So the number one reason why Zimbabweans are dying so young is HIV and AIDS. HIV is the leading cause of death in the country of Zimbabwe. It is responsible for 19.4% of the deaths in this country. I want you to think about this. 1 in 5 people that are actually dying in this country are dying from HIV-related causes. And for me, the sad thing is that this disease is no longer a concern in a lot of other countries, but in sub-Saharan Africa, the problem seems to persist. This is one of the most preventable diseases in the entire world because all you have to do is have safe sex. But unfortunately, our people are refusing to do that. Almost everyone has seen a commercial about HIV. Almost everyone has seen an awareness campaign on HIV and how it spread. But our people are still practicing unsafe sex. It really angers me when I look at the HIV statistics. Why are our people so reckless? And the answer is poverty. Majority of our people are living in poverty, which means that they're living in survival mode, and they might then fail to take necessary precautions to protect themselves from such a condition. When people are living in survival mode and are struggling to make ends meet, they're more likely to be reckless with their decisions. I'm so glad because our governments and NGOs have fought back, and we have gotten to the point where over 80% of the people living with HIV are on antiretroviral drugs. So HIV is the biggest killer in this country, but it almost never kills by itself. And that is what's going to take us to killer number 2. The second biggest killer in this country is tuberculosis. And to be honest with you, I used to think that most people that die from tuberculosis are HIV positive. So I thought that they were grouping, people with tuberculosis and people with HIV together, but that's not the case. There's so many other people that develop tuberculosis without HIV. So the reason why tuberculosis is the second biggest killer in Zimbabwe is because it is a tag team with HIV. A person with HIV is 12 times more likely to die of tuberculosis than a person that does not have the virus. In actual fact, TB is the leading cause of death in people that are surviving with HIV. In actual fact, there was a major study that was conducted in southern Zimbabwe, and it found that of the 78% of people that were registered to have tuberculosis, they were HIV positive. And unfortunately, more than 1 in 5 of these people lost their lives. So the issue of tuberculosis also has some sort of geography to it. TB clusters around central, western, and southern regions right here in Zimbabwe because these are mining areas. So a lot of makorokoza or artisanal miners are exposed to a lot of dust because they operate with minimal or sometimes no protective gear. And these are areas where there's also a lot of poverty and poor access to healthcare. And this takes us to the third biggest killer in Zimbabwe, which is heart disease and stroke. Almost everyone that I know knows someone that has died from a heart disease, high blood pressure, or stroke. I was actually surprised when I was reading this, but I had no idea that coronary heart disease, stroke is one of the major killers in this country, and it is usually due to untreated high blood pressure. We actually have a lot of people that have high blood pressure, know about it, are not on drugs, or some who do not even know about. In Zimbabwe, stroke kills about 93 people per 100,000. So we rank at around 80 in the entire world for the highest deaths caused by stroke. So unlike HIV and tuberculosis, which are considered to be diseases of the poor, high blood pressure is considered to be the disease of the rich. And this takes us to the fourth biggest killer in this country, which is lower respiratory infections. And pneumonia is one of these diseases. In actual fact, in 2021, pneumonia was one of the biggest killers in lower income countries. It was even higher than BP and stroke. The reason why pneumonia and other lower respiratory infections kill so many people is because it is the disease of the young and the old. People that are extremely young and people that are extremely old are affected by this disease. This is a disease that is very treatable, and the reason why it kills most of our people is because a lot of the people that die have very little access to health care. And lastly, the fifth biggest killer of our people in this country that is causing us to not live to old age is cancer, and most especially cervical cancer. According to WHO, Zimbabwe ranks at number 4 when it comes to cervical cancer, which means that we have one of the highest cervical cancer rates in the entire world. Based on WHO estimates, around 61 out of 100,000 Zimbabwean women are diagnosed annually. And apparently it is estimated that over 2,000 women die from cervical cancer each and every year. And that is a very astonishing number. The cruel part for me is that cervical cancer is one of the most preventable cancers on planet Earth. It is easy to discover because there's a screening test and it also has a vaccine. But as of 2019, only 20% of Zimbabwean women had been screened for cervical cancer, which means that we need access to more screening infrastructure to save more women. So here's the thing that we really need to talk about. Zimbabwe in 1980 was one of the most healthiest, most promising countries on planet Earth. When we became independent, our government led by Robert Gabriel Mugabe poured a lot of money in clinics and hospitals. Compared to other countries in the world and even in Africa, we're doing pretty well. Our people in 1980 were living up to around 59 years old. And the reason why we're doing so much better than other countries was because we had some sort of economic stability in our country. Things were going so well that in 1985, our life expectancy rose to around 61. So every single year, our life expectancy kept rising. But then suddenly, it started falling. And it was because of the AIDS epidemic. By the late 1990s, HIV was causing more than half of the deaths in Zimbabwe. And this is one of the reasons why our life expectancy fell. But HIV alone does not explain why our life expectancy fell, because this was the exact time where our economy was imploding. So because the economy fell, it meant that there was less money for hospitals, for clinics, and for general healthcare. Our healthcare infrastructure began to collapse. So hospitals ran out of strangers. They ran out of medicine. They ran out of painkillers. They ran out of antibiotics. They ran out of nurses. They even ran out of doctors because they began migrating to other countries for greener pastures. So picture this, the deadliest virus in the country arrives at the time where the economy is collapsing. This was a disaster. It was the perfect storm. So because of this crisis, our life expectancy fell from 61 years old to around 44 by 2002. So the core of this whole story is that Zimbabweans are not just dying because these diseases are unique to our country, but Zimbabweans are dying because the healthcare system collapsed when the economy collapsed. Moving on, if you actually split Zimbabwe's life expectancy by gender, you will notice something, that men live younger than women. And this is a trend that you see across the world. But in this country, women live longer than men on average, around 5 years. So the life expectancy of a Zimbabwean woman is around 65 years old, and the life expectancy of a man is around 60 years old. This happens everywhere else. It just depends with the difference. And like I mentioned before, Zimbabwe had a very unique situation in the early 2000s when women started living less than men. Everywhere else, men were dying first. But in Zimbabwe, during the AIDS epidemic, women started dying younger. So the reason why this is because most of these women were HIV positive, right? And when they were HIV positive, then they got pregnant and they went through childbirth, which is one of the most difficult moments in a woman's life. So because they got pregnant and gave birth when they were HIV positive, most of them could not survive. So for this reason, a lot of women would die soon after giving birth. And that's the reason why HIV seemed to kill women faster than men. It's because they endured a very difficult moment, which was pregnancy and childbirth. I mean, this is a condition that is very strenuous on a human body. It's actually considered a medical condition, by the way. So a lot of women would only discover that they were HIV positive when they were pregnant because there was mandatory testing at clinics and hospitals when you got pregnant. And because there was no treatment, most of these women had to endure being pregnant and being HIV positive. And this did not allow them to live very long. And here's the number that made me want to make this video. When I saw this number, I was dumbfounded and I was like, what? I had never thought about this. Every single year, Zimbabwe loses roughly around the size of Kariba in children under 5 years old. The current under 5 child mortality is around 69 per 1,000 live births. And this literally means that 1 in 14 children that are born in this country does not live to see their 5th birthday. And as of the recent data, under 5 mortality has actually dipped, but newborn mortality has actually increased from 31 to around 37. This means that the number of babies that are dying in their first month of life are actually increasing. And we should not consider this to be fate or destiny. We should not think that this is a curse that is coming from the gods, because multiple countries, including countries like Bangladesh, have been able to fix the system and cut child mortality. So although we now live 20 years older than people that lived in the early 2000s, we still are far behind the global average. So although we have managed to climb out of the grave, we are still standing on borrowed ground. So the only way that we'll be able to match the global average of 73 years old is if we improve our healthcare system. We need to accept that majority of the people that are actually dying in this country is because they do not have access to healthcare. And when I'm talking about access, I'm not saying that there are no hospitals in the areas. I'm saying the hospitals that they have access to, do they have adequate healthcare infrastructure and services, or do they have enough money to actually get the treatments done? So the major difference between Zimbabwe and Japan, it is not necessarily the food, but it is the healthcare. For example, the disease that is killing most women in this country, cervical cancer, can easily be prevented by a vaccine, and yet majority of us women have never taken the vaccine. And to be honest, because of how expensive the health system is in this country, how many of us have ever visited a doctor just to get checked? How many of us actually have gone for a checkup, especially a full body checkup? I've never gone to a full body checkup, and I'm 32 years old. I don't even know what's going on in my brain. I don't know what's going on in my heart. I don't know what's going on in my stomach, in my bones. I know nothing about my organs. And this is the reason why we're going to keep dying young, because most of us are walking with diseases and we don't even know we have diseases. And the moment we get sick, sometimes it's already too late. I always get frustrated when I hear people saying this person died because it was their time, it was destiny, it was fate. And I get so frustrated by that, because it means that we will not be active in trying to fix a system that is clearly killing us when we're still young. Dying young is not God's plan. It is not fate, it is not destiny. It is not the law of nature that Zimbabweans have to live below 65 years old. It is simply a reflection of our economy and our healthcare system. We have the same shot at life as a person born in Tokyo. And unfortunately, until we fix the economy, we cannot fix the healthcare system. And until then, we'll still die 20 years younger than a person that is born in Japan. My name is Elaine, and thank you so much for watching my video. See you in the next one. Ciao.